And these are today's panelists. So if you are here because you want to hear from these three wonderful people and the work that they're doing, you're in the right place. So I'll make sure to introduce our panelists a little later when we get into that session. Right now, I would like to ask Stacy to introduce herself, um, and we can pass it on to Stacy. I'm trying to find you here really quickly. Um, there you go, Stacy.
Thanks, Adrienne. Thank you so much. Could we go to the next slide? Great. Thank you, everybody, for joining us today. We are really excited to share the work that it has been the product of many months of hard work and learning on the part of our virtual student federal service interns, with lots of great mentoring from Adrienne. And we are really excited to have them tell you about it. We're also excited to share the report and the summary that Adrienne mentioned. Both of those should be ready within just a few weeks. So I wanted to share just a little bit of context about why we undertook this, and then also offer some comments from another angle. So it seemed really important to us at USAID to do this research, given that we were in the process of establishing a new agency-wide knowledge management and organizational learning function at the same time that everyone was grappling with and needing to learn about the pandemic and how it would affect our lives and our work and development generally. Knowledge management, organizational learning, and evidence infrastructures are crucial in any case to effective development because there's so much that we don't know and change is constant. But in a pandemic, knowledge and learning became even more important. We expect that what we've learned through the research the interns conducted will help USAID and other development organizations not only in confronting and adapting to COVID-19, but also in future crises. But before we get to the main attraction, I wanted to offer insight from another angle about how development organizations are using their knowledge management, organizational learning, and evidence functions to support their COVID response. So this angle comes from the Multi-Donor Learning Partnership. This is a network of 9 development donors who are leaders in the knowledge and learning space. I've been co-chairing this network on behalf of USAID since its inception 3 years ago. USAID co-chairs with UNICEF, and Kerry Albirght of UNICEF, who's one of today's panelists, is another co-chair. Besides USAID and UNICEF, the member organizations include the ones that you see on the slide. So these are Britain's Foreign Commonwealth and Development Office, FCDO, the Inter-American Development Bank, GIZ, IFAD, Wellcome Trust, CEDA, and the World Bank. The Multi-Donor Learning Partnership works to strengthen knowledge management, organizational learning, and evidence in development by convening to do 2 things. First, we share with each other what we're learning about ways to deepen knowledge and learning practices in our organizations and programs. And second, we champion knowledge and learning investments across the international development sector. So a little over a year ago, we started meeting to discuss COVID and how our organizations were responding from a knowledge, learning, and evidence perspective. It seemed immediately evident to all of us that COVID-19 presented obvious challenges and opportunities around learning, and also that the need for our organizations to leverage their respective learning functions was critical so that we could better understand what we were dealing with, how to respond, and how our responses were landing. For a lot of our organizations, this meant doing even more with even less. In many cases, emergency COVID funding didn't necessarily extend to funding knowledge and learning to support COVID response. Most multi-donor learning partnership member agencies needed infrastructure and knowledge management and organizational learning beyond what we had in place to enable us to learn from previous crises, to manage information overload, to discern high quality from poor quality emergent evidence, and to coordinate across the many learning and change initiatives that were taking shape in all of our organizations. Could we go to the next slide? So we were facing common challenges across our organizations, and some of our discussions focused, for instance, on the shift to working virtually and operating remotely from the countries in which our programs operate. For instance, GIZ shared how they were pivoting to remote program reviews rather than field visits. And we had a webinar with Nancy White, a leader in virtual facilitation, about moving learning events online. Other discussions that we had focused more on the technical evidence and learning around COVID impacts. Most of our organizations either did extensive analytic work internally or invested in synthesizing analyses that were developed by other organizations or both. And all of our organizations developed internal or external platforms to aggregate, synthesize, and share COVID knowledge and learning, all with the particular lens that's relevant to our respective organizations' mandates. As we moved further into the pandemic, it became clearer that both COVID as a disease and the responses to COVID by many governments at all levels were exacerbating inequalities of all kinds. There was a lot of information emerging, for example, about gender-based violence and socioeconomic inequalities. And many of our organizations grappled with what that meant for knowledge and learning. So multi-donor learning partnership members discussed these issues from a learning perspective. In terms of equity, we talked about what were our organization's COVID responses doing to take into account dynamics of inequality. Were we factoring into our programs sufficient efforts to mitigate inequalities and how community stakeholders were being represented in our programs and benefiting from them? What were we learning about this? Then, over the summer of 2020, the global protests and heightened awareness around issues of systemic racism that came in the wake of George Floyd's murder created openings in many of our organizations to confront more directly than we had before whether and to what extent our own programs may be exacerbating inequality. So there was a lot of learning there, and it's ongoing, and a lot of synthesizing of that learning still to be done. From the local knowledge perspective, what were our organizations doing to leverage the learning and insights that came from how local communities were responding to the pandemic? Where did those responses differ from what we thought we understood as donors about how to address COVID? And in terms of ethics, in most of our organizations, our citizen workforces came back home, leaving our local frontline workforces to carry on in communities in which the protections against COVID were often far less than what we enjoyed. Decisions that we were making about their exposure as they continued to engage local communities and monitor programs, even remotely, had important ethical dimensions. And on the workforce side, local staff were carrying more responsibility, often with no increase in compensation, and in many cases, without the computer equipment and internet access they needed to do their jobs. What lessons did this hold for our organizations and for future crises? And of course, all of our organizations grappled with workforce issues at home, such as how to support staff who are now also expected to be full-time parents and teachers to young kids. How are we supporting our respective workforces with training and virtual facilitation, with communities of practice and other knowledge sharing forums, and with ways to organize and share the huge amounts of data and information that were being generated? We shared around all of these topics and others as well, and we look forward to sharing more broadly with the development sector what we've learned. So here's what we have planned on that front. Could we go to the next slide? So we are currently working on a book that synthesizes learning from across the member organizations of the Multi-Donor Learning Partnership. And there will be a chapter on COVID-19 in that book, and that should be available in late 2021 or early 2022. And then also at our most recent meeting in April, we brainstormed another possible learning product. So we were thinking of this in terms of a checklist or a roadmap for our future selves, for future crises. Could you go to the next slide? So these are some possible checklist topics. We haven't landed on this at all, but this is what we're contemplating. These are the topics that emerged as important across our organizations. Ways to leverage lessons from prior crises, methods for coordinating and knowledge sharing, tools for data and evidence capture, synthesis, reflection, and application, tools for scenario and contingency planning, skill building for virtual work, principles for addressing ethics and equity, key contacts and references that we want to have on hand in a future crisis, the case for access to emergency funding for knowledge management and organizational learning, and ways to address workforce issues. So stay tuned as we compile and synthesize learning from the Multi-Donor Learning Partnership. But now I'd like to turn it back to Adrienne for the main event.
Thank you, Stacy. So now we will go to the interns, specifically Mahidir, as they will give a brief background on the report. And then after this session, we'll go into the Q&A session. Mahidir, take it away.
Thank you, Adrienne. Just to continue, in order to meet USAID's goal in adapting its development assistance programs to respond to the challenges presented by COVID-19, USAID's KMOL team has developed a learning agenda to provide a framework for knowledge synthesis. The framework draws on insights and identifies lessons learned that can be applied to a wide range of stakeholders. In consideration of the learning agenda, our team identified key challenges for our project and adapted our qualitative data collection tool for the interviews based on those challenges. The selection of interviewees was made possible through the utilization of the Knowledge Management for Development, or KM for Dev, community of practice, which is an online platform. And we also used our own professional networks. Through this process, the team identified 13 respondents to participate, and this was all done through email. For the most part, the interviews lasted around 40 to 50 minutes each. Most of the questions were open-ended in order to allow for interviewees to expand on any particular topic or work they were doing that they wanted to highlight. As for the individuals we selected to be interviewed, we sought to speak with those working or leading knowledge management initiatives in some capacity. Next slide, please. And sorry, go back for 1 second. And these are the list of the organizations that we interviewed. Next slide, please. So following the completion of the interviews, the team transcribed the interviews that we had and identified key themes that came across the various organizations that were interviewed. In the end, we were left with the following 4 themes as our key takeaways from the process. The themes include managing emergent information, brokering and applying local and organizational knowledge, lessons learned from the pandemic and other crises, and last but not least, looking ahead to the future. And moving ahead, my teammates will expand on each of these themes above.
Hi. In the following slides, Milo and I will be providing a summary of findings from the themes we identified. All of the case studies and specific examples mentioned can be found in our upcoming full report and 2-pager. The first theme we identified was the management of emergent information. We found that for information collection, in-person processes have been adapted with social distancing guidelines and mask usage. In the event that in-person contact has not been an option, organizations have turned to virtual and digital platforms. Virtual and digital capacities have been bolstered by leveraging phone lines and online platforms such as WhatsApp, Zoom, and other platforms to effectively engage with local communities. We also identified challenges arising from 2 distinct types of disinformation. We found that disinformation spreading at the community level by word of mouth, internet platforms, etc., sows distrust in response efforts. Organizations have utilized relationships with local contacts and governments to combat the spread of this type of disinformation. The second type of disinformation we identified is in the form of preconceived notions that affect development organizations' understanding of their response strategies' local context. The effects of this type of decision-making, that is, decision-making based on preconceived notions or out-of-date information, is highlighted by the Alliance of Biodiversity International and CIOT's case study of Vietnamese wet markets, whereby outdated and inaccurate information regarding wet markets were used to guide COVID-19 policy response. Moving to our findings on brokering and incorporating local and organizational knowledge, we found that with the large amount of information coming from and to organizations, storing and sharing local knowledge has been a priority. Many organizations are using COVID-19 learning hubs that organize information from a wide range of local sources. The Africa Center for Evidence has a repository of all known COVID-19 learning hubs, including those of the organizations seen in our report. Beyond the collection of local information, applying that knowledge has been pivotal to effective and efficient response strategy, as seen in the wet market case. We found that organizations are iteratively adapting and applying local knowledge to increase response effectiveness for vulnerable populations. The emphasis on vulnerable populations is displayed through CARE's 2020 report, She Told Us So, taking gender-based knowledge from March, June, and September of 2020 to provide a comprehensive understanding of what issues are impacting women in the rising inequality under COVID-19. Finally, we found that engaging local stakeholders has been an important facet in response efforts. Local engagement for combating COVID-19 is stronger where existing networks can be leveraged. This is true in communities with established communication networks such as phone numbers and local key contacts. Furthermore, traditional communications media such as radio regained importance for stakeholder engagement under COVID-19. This is illustrated in IFAD's use of radio in Nepal, which allowed organizations to engage community members without access to virtual resources. In this case, radio was used to broadcast advisory services that were cut off as a result of mobility restrictions of the movement of goods and people. I will now turn it over to Milo to discuss the final two themes.
Thank you very much, Lily. So to ensure that development organizations could adapt their programs and interventions to the needs of the ongoing COVID-19 pandemic, they had to utilize lessons learned from two sources. So in terms of learning from impacted communities, organizations had to engage with their stakeholders in the geographies they serve to gain a deeper understanding on what works, what does not work, and what could be improved in relation to the changing program demands resulting from the pandemic. We found that engagement came in different forms and activities, such as knowledge sharing and peer support, promoting country to country learning through building communities of practice and working groups, and proactively gathering information and documenting lessons on work being conducted. In terms of responding to previous crises, organizations were able to adapt existing resources, frameworks, and lessons learned and gear them towards COVID-19 response efforts. Even when not directly related or attributed to pandemics, any available knowledge was considered. Some examples we came across were lessons learned from fragile and conflict-affected situations, as well as from natural disasters. So these situations imposed restrictions on mobility and in providing relief to impacted communities akin to that of the COVID-19 pandemic. Next slide, please. Thank you. So as far as future crises are concerned, our interviewees mostly agreed that a global crisis of this magnitude is likely to happen again in the future, and they expressed the need to remain vigilant and to prepare for this eventuality. So from our analysis, we found that shortcomings in digital infrastructure and experience working in virtual settings prior to COVID-19 slowed down initial response efforts and strategies. Thus, investing and building in digital capacity that will facilitate robust organizational and knowledge sharing processes is one area that development organizations can focus on moving forward. Another important theme to consider is reflecting on the successes and challenges of COVID-19 response efforts and other crises, and ultimately applying what has been learned from these experiences. It is crucial to take into account where the knowledge gaps were in these situations, how these gaps were addressed, and how learning agendas were formed and implemented to capture vital information used in making programming decisions. So thank you very much for listening in to a brief overview of findings from our report. With that, I will give the floor to Adrian to introduce our panelists.
Okay, thank you so much to all of you for presenting. Before we introduce our wonderful panelists, I want to again thank the four of you, Stacy, Milo, Lily, and Mahadir, for presenting today. And if we could all give a round of virtual applause for our three wonderful interns who really led this work, we would appreciate it. So yeah, thank you guys. You did amazing. just a couple of reminders I've gotten from a couple of people on the chat directly. We are recording this session and we will make it available online. We'll either post it online and share it via email, and it'll also be included in the report and 2-pager. So there will be multiple ways of finding the recording if people want to refer back to this conversation. The other thing is, as we go now to the main event for today's webinar, this panel session, if you have any questions for the panelists, please feel free to add them to the chat. We will be monitoring the chat there will be a second, or the second half of the panel discussion. We'll be taking questions from the audience. So if your question is directed at one of the 3 panelists, feel free to indicate that. And if you can let us know your organization or where you're at in the world, that would be wonderful for when we read that question. Okay. With that said, I want to thank again our 3 panelists and welcome them and all of you today. Our first panelist that you can see on the left is Kerry Albirght. Kerry is the Chief of Research Facilitation and Knowledge Management at UNICEF's Office of Research, Innocenti, based in Florence, Italy. She oversees institutional work across research governance, including quality assurance and ethical evidence generation, evidence synthesis, capacity strengthening, uptake and use of research evidence and strengthening, and evidence, knowledge, and learning culture across UNICEF, staff, and partners. Prior to joining UNICEF, Kerry worked in various senior roles at the UK's Department for International Development, now the FCDO. In the middle right here, you can see Emily. Emily Janoch is the Director for Knowledge Management and Learning at CARE International, focusing on ways to better learn from, share, and use implementation experiences on eradicating poverty through empowering women and girls in order to improve impact. With 14 years of experience, Emily is an expert in designing systems to capture and share information across many sources and facilitating conversations with practitioners and decision makers. She has a BA in International Studies from the University of Chicago and a Master's in Public Policy in International and Global Affairs from the Harvard Kennedy School. And our third panelist, last but certainly not least, is Gabriela Keseberg Dávalos, who is the head of communications at Southern Voice, a network of 51 think tanks from the Global South. She is in charge of designing and implementing the media strategy for each research project to maximize its dissemination. Prior, she was the senior foreign policy advisor to the vice president of the European Parliament for Human Rights and Democracy and a senior communications officer at the International Crisis Group. Her articles and podcasts on international conflicts and human rights issues have been published in outlets like Die Zeit, El País, and Washington Post. Gabriela is a multimedia journalist, political scientist based in Bolivia. So thank you. Let me, Lily, let's get the presentation off and then I will. Perfect. Emily, Gabriela, let me unmute you, and Kerry, I will pin the 3 of you or move you to stage. So if you can, in the layout, change it to side by side, you would be able to see Kerry, Gabriela, and Emily front and center. So that's just a trick for the audience. But thank you again. Welcome. We're really grateful that you're here with us. And in line with the report and today's conversation, I guess I wanted to start. Emily, I see you first on my screen, so let's start with you. Could you tell us a little bit more about how you and CARE have been managing the large amounts of information that have been coming out around COVID-19? We know that has been, it's been a lot. It's been a lot that's been coming out. Information and perhaps not information or disinformation has been coming out. So how have you and your organization sifted through that and managed that type to put forward different programs and whatnot?
Yeah. So just to give everybody some context, CARE operates in 100 countries in the world, and at any given time, we've got about 1,300 people. In COVID alone, we've responded with about 32 million folks. So it's a huge scale and volume, and it's also happening in a lot of different contexts. So we've done a couple of things, and part of what's really important is making sure that there is leadership and resources available at all levels to manage this kind of information and to think about what is most relevant and important at the level where those decisions are happening. So we have something called the SITREP, which is the situation report. It's pretty standard in humanitarian affairs. This is the first time we had to do it in 100 countries all at the same time about exactly the same crisis. So building some tools that allowed us to do that. And that collected a huge volume of information. And so country teams were at the beginning every week. Now it has slowed down to a monthly cadence, just putting in lots of different kinds of detail. And the trick was then who's using that. So instead of going back to the country team and asking them to repeat information they'd already put somewhere, how did you lift that out and make it usable for folks who needed to see it? So we had a combination of infographics. We have something at CARE we call 5 minutes of inspiration, which is once a week sending around an email of here's something amazing that's happening at CARE. And so part of what we did with this was to say in COVID, take one theme basically every week and say what's happening around this, what are the countries it's happening in, what are some really standout examples of innovation or creativity happening. So early in the pandemic, it was what is everybody doing about hand washing, or what is everything we have done to respond to pandemics in the past, epidemics in the past, and what could you learn from that? So thinking about giving people short snapshots and giving them kind of high level, here's a graphic, here's where you can go to find more, really helped sort of sift through that huge sea of information. One of the other things we did was really prioritize participant feedback and particularly women, and understanding what are they saying. So we have a project called Women Respond. I can drop the link in the chat that pulls data from women participants across all of the places where CARE works to say, what's your biggest need right now? And very early in the pandemic, they said, you're treating this like it's a hand washing problem. And for us, it's a food problem and an income problem. They didn't say it quite as directly as that, but is that they said, one woman in West Africa said, I can't let my kids starve because of a cough. And so how did we, making that shift really early, because participants were saying, your assumptions have misdiagnosed the problem and we need you to think differently about what you're doing here. Getting that built back into our responses was really critical.
Thank you. And I want to ping this because we do want to talk about stakeholders and how we are including different voices, but we'll circle back to that point. But that's really important. Thank you for mentioning that. And thank you for sharing that insight about taking the themes. It's something that is definitely unique and interesting. I guess I'll turn it to you now, Gabriela. Same question. How did you and Southern Voice manage large amounts of information? And specifically for you at Southern Voice, as you are a collection of think tanks, right? And you're also doing your own research and putting forward reports. How did your stakeholders and staff at Southern Voice were able to perhaps sift through that and put forward all these pieces of research? And then how did you compile them and put key information forward for others to learn from? Let me unmute you. There we go.
Thanks. Yeah, sorry, I muted myself and then it said you can't unmute yourself anymore. I was like, oh my God. Okay, thank you for that. No, thank you, Adrian. Well, yeah, exactly. So what we did at Southern Voice is that we created this COVID-19 knowledge hub, where we basically first at the beginning, it was really just collecting everything that our 51 think tanks were publishing, which happened really fast. I mean, I have to say that was admirable. While I was listening to Emily, I was actually thinking back at how things started. It seems such a long time ago, actually, you know, because I mean, it's been over a year, but it seems like 10 maybe, I don't know. But I remember that actually the very first thing that our director did when the pandemic started was reach out to the network members, right? And actually just check in and be like, okay, how are you doing? What are you doing? Can we support you, etc. Which was really important because I would say that none of the 51 think tanks had ever worked in a remote or, you know, virtual manner. So there was actually a lot of training that we had to give also from our side and so on. But then amazingly, you know, maybe because in the global south, we're so used to crisis, you know, mostly economic and political rather than health crisis. Everyone adapted really fast and started publishing. And when we saw that, very organically, you know, the idea came up to collect it and to make it available for everyone outside the network. And that's how the idea of the hub came up, which now has probably already around 1,000, you know, publications, articles, podcasts, webinars, etc. And yeah, I mean, there've been definitely a couple of challenges to put all that information together. We're a very small team at Southern Voice. So, you know, like one of the small things we did, for example, is we created our own search engine that scans just those 52 websites, basically looking for the material. But even then, there's also a lot of manual work that has to be done. And we continue doing it. Yeah, so those are just a few of the things that we did to get all that information together, but it's quite challenging if you have that much. So my admiration to Emily, because it's so much more even than for us.
Thank you, Gabriela. And we should share your hub in the chat so people, if people are not aware. Oh, there we go. It is really a wonderful collection, and we had the opportunity of having Gabriela walk us through it. And there's a lot there. So that's been something that organizations have been doing, of course, and hopefully we have enough time to get into that. But Kerry, I'm going to switch a little bit. I know that UNICEF has been doing a lot on this, but I wanted to kind of pivot some more and ask you specifically about your rapid research response agenda and how UNICEF has been iteratively adapting COVID-19 response strategies based on emergent knowledge. So based on all this knowledge that is coming out. Can you tell us a little bit more about that effort and give us some background on that?
Sure. Thanks, Adrian. So for people that maybe don't know, the part of UNICEF that I sit in, UNICEF Innocenti, is the dedicated research center based in Italy. So obviously our mandate is largely around research evidence and learning. So I mean, as was said already, I think, you know, when the pandemic struck, I think the initial institutional response was that it was a health emergency that we had to deal with. And common wisdom was that, you know, children weren't particularly affected by the pandemic, and it largely affected adults. But I think as things unfurled, it soon became pretty clear that actually, you know, children were bearing a really disproportionate burden of impacts from COVID-19. So, I mean, obviously things like school closures spring to mind, but also increasing mental health crises from lockdowns and isolations. Stacey already mentioned increasing amounts of violence, gender-based violence, including violence against children, growing child poverty and inequality. I mean, just to name a few areas. So we were trying to develop a sort of rapid research agenda, and it was immediately obvious, you know, that the traditional research timeframes were going to be far too long to yield useful insights for the pandemic response. So we had to work quite hard to shorten our traditional research timeframes without sacrificing quality. So, I mean, there were really sort of four elements around it, I think. There was primary research that we were doing in some of the areas already mentioned, with a turnaround of sort of 3 to 6 months. There was also a really big push, again, as Stacey mentioned, from the MDLP, around evidence synthesis to try and summarize lessons from previous pandemics and epidemics and to inform how we might respond to COVID-19, particularly in relation to children. We also had to start adapting in terms of data collection, as you might expect, guidance, how we adapt data collection, how we might use new digital tools, etc. And then finally, we're lucky enough through the UNICEF network to have access to a sort of a big network of international thought leaders. So we instigated this seminar series called Leading Minds Online, where we were getting key individuals from governments and elsewhere from around the world to share some of their experiences and insights into issues such as, combating misinformation or disinformation, if you like, in an era of information overload, issues of vaccine equity, the looming debt crisis, etc. So it's an ongoing process that's feeding into UNICEF's learning, and perhaps I'll talk a little bit later about some of the work of other sections beyond Innocenti.
Thank you. Thank you so much for sharing with us. Just want to send a quick reminder to everyone that if you have questions, feel free to add them in the chat, because we will be getting to those questions in the second half of the panel. But yeah, this was briefly mentioned, and Kerry, you just talked about doing primary research, which is goes along with what Gabriela and their researchers do within the think tanks of looking up and doing your own research. But I was curious, and I remember this from a conversation we had with Gabriela a while ago, and tying back to what Emily mentioned earlier about those local stakeholders. How do you, I know for Southern Voice, Gabriela, let's start with you. Your think tanks, or the network of 51 think tanks, are located across the global South, and you have people from the countries, right? Residents from the countries that are actually doing and driving the research. And I know there was a big emphasis from Southern Voice to make sure that there were different voices represented and different perspectives represented. Can you tell us a little bit more about that and how you drove that, specifically to local knowledge and the needs that are present, that are actually the needs of the people that we're trying to help?
Yeah, thank you, Adrian. Yeah, the mandate of Southern Voice, is precisely to make those Southern voices and perspectives heard on the global stage, right? And to underline the importance of local knowledge produced locally, etc. And I think at the beginning, Stacey also mentioned that when the pandemic started, if I understood correctly, you had to pull out also staff from many of those countries, and only the local staff remained. And that is what happens quite often, right? And the advantage that Southern Voice has is that we're talking with, about researchers that are from the country, have been in the country, know how to get around, know the language, etc. And they won't leave, when crisis hits, because it's their home country. It's what's happened to all of us, right? So leveraging that knowledge, and having a network like ours where you can go to when a crisis like this one hits, and who will probably also know, okay, how can we adapt our work right now? I think it was already mentioned in the presentation by the interns, everyone had to adapt, for example, for their interviews and data collection, etc. Obviously, you couldn't do it in person anymore. Well, the same happened with our researchers, of course, but if you are from the place, usually you know how to move around those things, and that happened really quickly. So that is also why they were able to publish so quickly analysis, etc., which usually, just like Kerry was saying, would take much longer. And especially think tanks, they love researching for a long time before publishing. So it was quite amazing how fast they came up with all this on-spot analysis. And now, obviously, they are actually working on mid to long-term research and recommendations. But at the beginning, they were really fast with their first analysis and recommendations because they were seeing firsthand what was going on in their countries.
Thank you. Thank you, Gabriela. Yeah, that makes sense. And I see that there is a lot of interest in the chat, so maybe we can revisit this specifically, how priorities in research have changed from the beginning of the pandemic towards like now that we've been in it for a little longer. But I want to turn it to you, Emily, because you mentioned earlier the participant feedback, right? And you made the comment that participants said, well, you're reading this wrong, like what we need is this, or, this is a food problem for us. So if you could tell us a little bit more about how you actively sought to hear from those people, from those communities and those voices, and what kind of methods did you use to kind of gather that feedback, given that, we're in a global pandemic, that we can't be indoors, and all of these other limitations? How were you able to overcome that?
Yeah. And one of the things that was amazing about this process is normally what we would do in a situation where we were trying to study something is we'd spend a very long time vetting research tools and sort of building, okay, here is the tool, and then trying to convince everybody in all 100 countries that they had to use exactly the same tool with exactly the same technology. And that doesn't work, and it takes a really long time, and it's incredibly inconvenient for the people trying to get the work done. COVID just didn't allow us any of that time to deal with any of that. And so what we had to do was focus very quickly on what are a couple of questions, just a few. And particularly as we moved to, in places where it was possible and it made sense, to things like SMS-based surveys or interactive voice response surveys. It's amazing. It puts the power back in the hand of the participant, and they will literally just hang up the phone. And we see they hang up the phone at like 9 questions. So you can add questions 10 through 15, but they will hang up the phone and you'll never hear the answer. So you really have to prioritize. And that was hard for us to, like, that's not, we're learning people, we want to ask all the questions. And so really zeroing in on what is the most important pieces right now. What do we need to know that we're going to do something about? And it really forced us to think about what is the action we will take and how does that guide the questions we ask? And that's not how we usually go about this kind of process. So part of what it also did was meant every country could pick the technology that worked best for them and the platform that made the most sense. So in refugee camps in Jordan, everybody said, please use Facebook. That is what is helpful for us. That's what we are on all the time. In West Africa, people were using WhatsApp. In Malawi, we did SMS-based surveys. And part of what happened then was it turned out women were giving us phone numbers, and we had, 10,000 phone numbers. But really, those 10,000 phone numbers only represented a very small number of people, because every woman in the community would give you the same phone number because there was only one of them who had a phone. And they assumed that if we were going to call them and say, here's the activity or here's the messaging you should share, that one person would then go share the information with all the people in her group, and that would work fine. It doesn't work well for surveys at all. So, and then in some places we were able to do in person, local field staff were able to do some of those conversations. Another thing that was really critical for us was getting our staff, our implementing staff, involved in the research process. And I think that did more to make sure we were including the research in our decisions than anything else would have. Because if you're actually talking to people and you're actually asking the questions and having a conversation, that's so much more motivating than reading a report 6 months later. And so we saw people were enacting changes before we even had the data into the system.
That makes a lot of sense. And I guess if you could briefly comment a little bit more. So you mentioned that based on the country, they would say, oh, well, Facebook is what works here for us, WhatsApp over here. Did you see, was there any variation in the types of needs and the types of questions that they wanted you to ask based on regions or countries? And how did you manage that as well?
Yeah. So what we did was we had 3 questions we tried to get in as many places as possible. We tried to have as many people ask, and they were pretty high level. So it was, what is the biggest impact in your life right now? What do you need most right now? And what are you already doing? And that was one of the things that was amazing for us, because it's not standard in this kind of a response. It's not something we'd done before, is to say, how are you already leading? How are you already dealing with this crisis? In some places, by the time CARE could get access again, women in communities had gone to the local power company and said, can you pay for hand washing stations in our markets and we'll put your brand on them? And so they were already coming up with solutions and doing things before we ever showed up. And so being able to showcase that and being able to talk about how important that leadership is was new in emergency response for us. And so something we're really excited to see. And then after those 3 questions, then there was space to customize. So if you needed to ask a couple questions about a specific, if you were faced with a compound crisis and you needed to ask what's going on with the flooding or what's happening with the cyclone, you could add a couple there. People who were focusing on something like savings groups, which we do in a lot of countries, could add a couple of questions there. So having a really short set of global questions and then allowing space for a couple of others.
Thank you. Yeah. It makes sense, right? And this is something that us at USAID are also really thinking about critically, is how do we make our responses local and reflect the needs and the voices of the people that we're trying to help, and our missions globally are, of course, leading the charge over there. And there's a lot that we learn on a daily basis from them. So I'm really happy to hear this from others and to be able to learn from you as well. I want to turn it to Kerry. Kerry, I have this curiosity, right? And along with this same question on stakeholders, but UNICEF's focus is children. So how does that affect and come into your research specifically for COVID as you're trying to adapt programmatic activities? How do you include the voices of the children? What roles do parents take, if any? I'd be really curious to hear about that and how you do that knowledge sharing and collection process with not adults.
Sure. So, I mean, if you're talking about vulnerable populations, children, by definition, are a vulnerable population to start with, even before you start looking at sort of particularly vulnerable subgroups of children, so those that maybe are disabled or street kids or orphans or indigenous kids, etc., who are often outside of the reach of traditional sort of programmatic responses. So, I mean, just as a kind of a key stat, I think, what we found, we've been quoting, approximately 150 million additional children are living in multidimensional poverty now because of COVID, without access to education, healthcare, housing, nutrition, water, whatever, because of the pandemic. So like others, we also, we're lucky we have a particular mechanism called U-Report, which is quite well known now, where we basically engage with youth community reporters. I think there's something like 300,000 of them worldwide now in 40 countries around the world, around sort of short polling questions, getting a chance to ask their feedback, their views, etc. on COVID response, which has been really helpful. But of course, then that is just those that are already young people that are already able to engage through digital technology, which is not everybody by any way, shape or form. So, I mean, I think the whole issue that others have been talking about, a real recognition that we really needed to rely on our community networks and mobilizers became really critical, particularly, listening to some of the community's fears and perceptions, understanding things like the social norms or the trust factors to help combat some of that misinformation, and whether or not people complied with pandemic control measures or acceptance of the messaging or not. So young people were involved in that as part of the community, and it was really important, I think, to get their views. They're experiencing the pandemic in very different ways. So even in sort of offline environments, we were looking at ways to share content, to engage them, to build dialogue, and to try and work with young people as trusted interlocutors to sort of weave together scientific and cultural messaging, I guess, to strengthen the relevance and acceptance. So I think young people also really have very strong views about a post-COVID world and the longer term recovery. So it's been really important to think about how we, to use that horrible jargon, how we build back better. Getting their perceptions on that has been really important for us as well.
Thank you for, it's definitely a complicated issue and important, right? There is a big push in the development world of including local voices. And that's something that us as an agency, as a knowledge management and organizational learning team, are always looking towards, seeing what our partners and allies and folks like you are doing, and also our missions, right? And making sure that we do more of that and do it to the best of our ability. I want to go back to you, Kerry, for the last question of this session, and then I promise I will open it up and start asking questions from the audience, because I see this chat is very, very active, and I'm really grateful for that. But I wanted to ask you, just to kind of close this part, can you comment a little bit more on some of the lessons that you have gained from your response, and how are you planning or thinking about capturing those lessons so that it could help you inform possible future crises?
Yeah, I mean, I think there are sort of at least 3, probably even more, sort of different streams of lesson learning that are going on across the organization, which is something we might want to discuss as well, about the proliferation. But so I mentioned earlier that my colleagues we have another team based in New York, a learning and knowledge exchange team, who led a lessons learned exercise from across UNICEF's programmatic COVID-19 response, dealing particularly with country offices and regional offices. And that was looking at proliferation, I think 300 documents, websites, interviews, etc., particularly trying to capture tacit knowledge about rollout response to previous pandemics, such as lesson learning from Ebola, for example, and how they might respond. And that report, I think, should be published pretty shortly. I mentioned earlier as well that there was also a kind of science response, I guess. So at Innocenti, where I'm working, there was a lot of stuff around learning from the past and planning for the future. So we conducted an evidence synthesis looking at the impacts of previous pandemics and epidemics, such as Ebola, HIV/AIDS, on child protection outcomes, just to name one of these studies. And as others have said, it was really quite appalling. There was a distinct lack of evidence from previous pandemics to inform the response, particularly around children. Where it existed, it was really around HIV/AIDS response and its effect on stigma. To a lesser extent, a little bit from the Ebola crisis in West Africa. But the vulnerable subgroups that I mentioned earlier, street-connected children, disabilities, indigenous kids, I mean, just completely out of the loop, hardly any chance to sort of learn from that. And then I think there was a sort of organizational stream of lesson learning as well that we haven't touched so much upon here, but it was also in your report around sort of staff welfare, well-being, how people adapted to working remotely, burnout, stress, remote data collection, and all of those sorts of issues. So I think there's a sort of organizational learning stream going on as well, which leads us to hope that we would actually, recognize the value of knowledge management and organizational learning to plan for the next one. But some slight skepticism about, with large decentralized organizations, how easy that actually is.
Thank you. Yeah, and that's been to that last point, something that I've seen just briefly pop up in the chat is how we're planning, as different organizations that are doing all of this work, how we're planning on trying to put it in a single place where it's easy to find and people can get to the information as quick as possible. But yes, I will turn it to you, Gabriela. Same question. Lessons that you've gained, and how do you envision Southern Voice capturing and sharing these lessons to inform possible future crises?
Yeah, thank you, Adrian. Well, I mean, it was our first major one. So we didn't have anything before where we could say, okay, this is how we did it before. That said, of course, our researchers in Africa, they did have the experience with the Ebola crisis, and that, reflected in their research and their analysis. Same, in Asia, they've had experience with pandemics before. I would say that it's mostly the Latin Americans that we're really for the first time, what's going on here, In terms of lessons learned, yeah, I mean, it's definitely something that we need to capture, and I think it has yet to be put on paper or somewhere. but it would be a very good exercise for us, precisely because, if this happens again, how can we, use those lessons learned, etc. The main lesson I would say is that, the incredible resilience of our teams and researchers and how they adapted so quickly. Another really wonderful thing that happened was that because we worked together on this hub, the internal communication within the network has become so much better. And which was something that we were trying to work on anyways, and then it was accelerated thanks to the pandemic. And there was a real sense of pride also, of joint pride because of this product. So that was really great. And I think, definitely the exercise of sitting down and writing down those lessons learned is something that we need to do as a network, and that will definitely inform any future crisis for sure. Oh, I can hear you.
Adrian, we can't hear you.
I unmuted myself so I could take notes in the background. And but Emily, I wanted to turn to you. Thank you, Gabriela. That is really insightful, and also, in a way, like you mentioned, you didn't have lessons learned from your organization or your think tanks before this pandemic, so this is your first major one. But it's really interesting the way that you're putting out the research and thinking about that, right? And to this question, just to give a brief background, is it was part of our intention with this report of collecting knowledge and trying to put some answers to some of these questions and what other organizations are doing in one place. So hopefully when that is cleared and published later this month, people will be able to reference that. But Emily, to close us out before we go into the open Q&A, again, what lessons have you learned from your response, and how are you thinking of using those to inform potential and possible future crises?
Yeah. So, and there's a great comment from my colleague Uwe in the chat box about what I'm about to say, which is one of the things we learned, and this isn't a surprise for knowledge managers, is you have to focus as much on use of information as on the production and storage of information. And it is so easy to just let that slip and to focus on what are we creating, what are we publishing, what are we writing down. And if you're not using it, then there wasn't a lot of sense in investing in that in the first place. And that was a big lesson for us, that we did collect all of this data at the beginning and had all these systems in place. And then people were still picking up the phone and calling the country director and saying, I have a question about. And the country director is like, I've written this in 5 different forms. Why are you asking? Go find one of the forms. How do you focus on that uptake and use? And how do you make it so that you're actually changing? Because that's part of the incentive to do knowledge management at all, right? That's what changes it from an extra nice to have to something that's motivating, is when you see it changing how the organization behaves. One of the things that CARE has done in our humanitarian programming for over a decade now is after action reviews after crises. And so sort of the very first thing I did during COVID was go back and look at 10 years worth of after action reviews specifically relating to diseases and saying, okay, what does this tell us about what needs to happen now? But how do you generate that in ways that people can do something with that information? And so we have been doing sort of after action reviews with different parts of the programming as we go along. I think another core lesson for us is that the programmatic piece, the content and what's happening with women and what are they telling us, is critical, but also the operational piece. What do we have to do to change our procurement systems? What do we have to do to change the way we work with partners? And that was part of what was really telling in the after action reviews, is that we notice those every time, but then we don't always make the operational shift that we need to. It's so easy to fall back into, okay, it's not a crisis anymore, here is the way. And we really do have to make those operational changes, and we have to sustain them through non-crisis periods so that when a crisis hits again, we've actually, as somebody said, when people tell you it's going to rain, it's not enough to say, okay, I know it's going to rain, you need an umbrella. I think you have to make those changes so that you're ready when the next crisis comes.
Thank you. Thank you so much. And really important point on not only collecting it, right? Collecting the information and the feedback, but making sure that we act on it and that it is incorporated and reflected in what in what our programs and what our activities look like. Thank you all for the wonderful for all your insight and knowledge. I know we love to use the K word, that's what I call it. But really, the three of you are so knowledgeable, and we're really grateful to have you here. So thank you again. I'll switch it up now and start getting some questions from the chat. I know the chat has been very, very alive, and I've been getting some of those questions directly to me. Just so we know, we're here until the webinar will go until 9:30 a.m. Eastern time, or 30 minutes past your hour, wherever you are. I will start with, let's see, I saw this question from Albert Waudo. Oh, I see there's technical glitch. A comment came up and was blocking the question for me. You see? I would like to, oh my God. Wow, look at this. I wonder if I could turn off the chat.
Yeah, you can X out the chat.
That's what I'm gonna do. Thanks for a great presentation. Albert would be interested in knowing how radio programs were structured to ensure that they still resulted in the outcomes they were targeted at. For the programs that shifted to radio, were the radio activities standalone, or were they accompanied by other interventions so that they were more targeted at specific beneficiaries? Who would like to start us off with that question?
Well, Adrian, in our case, one of our teams, they definitely turned to radio because the internet connection, etc., wasn't that great. But it wasn't a standalone activity. They also they had other research methods as well, but definitely they used radio. This was in Uganda.
Absolutely. And we know that there are definitely some barriers, right? Like, because of COVID-19, we cannot necessarily be in person everywhere. And for some people, there are some technological barriers. So a lot of organizations in different parts of the world relied on radio to get the information out. Do you know how those communications were working? What kind of information was being put by radio to get the information to communities? Was it more, wash your hands, do this, or we have these type of programs and aid that are coming and this type of help?
No, I mean, I don't know the exact details, but definitely it had to do with the research that they were doing, which was they were comparing a lockdown versus not lockdown situation between Tanzania and Uganda, which had to do specifically with the fisheries sector around Lake Victoria. But I don't know exactly what they were asking or how they were doing it. But I mean, the great thing about radio will always be you don't need electricity, right? You don't need any internet connection. It's not digital.
Mm-hmm.
You get it anywhere. So because I see it in Bolivia as well, it's the same thing. Radio will always be reliable, actually, versus TV and internet, etc.
From UNICEF side, it's not something that I know very much about it, because we're just about to get it up and running. But again, from a sort of communication for development perspective, we have a team working out of our program division in New York who are collaborating with Wellcome Trust, using radio through a network, Wadada radio, which is a sort of kids programming radio, to try and get kids, not so much, I think in this instance, to inform about COVID response, but to think about future research questions to inform longer term research agendas around mental health, around non-communicable diseases, etc., in a sort of post-COVID context. It's just getting off the ground now, but it was a deliberate choice again to go back to radio. So that is an interesting piece of work that is about to get underway.
And CARE, a lot of programming did use radio, usually as one component of broader programming. So it was very rarely a standalone. We assume that if we send a message on the radio, then everyone has changed their behavior. As much as possible, we tried to pair that with two-way communication. So either people could call into the radio show and ask questions or provide feedback, there'd be some kind of a hotline they could call into, or it would be paired with some kind of, health volunteers or other communications methods that were not just mass media one way.
Thank you. Yeah, I was curious about that because I know that is a reliable way of getting information and slightly more accessible to many people and many communities than other types of internet-based software and whatnot. Another question. So video did not kill the radio after all. Another question that came in from Peter Ballantyne is, do you see this, all of these efforts translating into more and better and different sustained investment in KM and learning? And what one KM investment will best set us up for the next crisis? Let's say the climate emergency.
Peter, well, Stacey mentioned this earlier. This is actually something that the Multi-Donor Learning Partnership, the MDLP book, is also going to look at to try and draw together lessons. I hate to say it, but actually, I think what we've seen is that a lot of the funding that even maybe might have been going to programs was redirected in many of our agencies to go to sort of immediate COVID response. And the usual story, I think, with things that are seen as luxuries, KM is not a sector that tends to get a lot of investment anyway. But with sort of a likely global economic recession and budget cuts and to ODA and stuff, I think KM is not going to be flooded with additional resources in the short term, at least. Part of what we're trying to do through that book is actually saying, if we had have actually invested systematically in better knowledge management, organizational learning systems, documentation, etc., then perhaps we wouldn't all have been quite so caught on the hop when the pandemic broke. Some things should be so blindingly obvious, like the need for it to incorporate social science responses rather than just a sort of health response into crisis response. And we're still sort of reinventing the wheel. So I think it's part of a broader case for support, or a business case that we always sadly need to make for the value of KM and OL. But if our response to COVID doesn't prove it, I'm not sure that anything will.
Anyone else? Thank you, Kerry.
Yeah, one thing I would say is that, and we've had a little bit of this going in the chat, is part of what we saw at CARE was how much we were able to leverage previous investments in KML, even ones that were not a huge amount of money. And I think this is part of where we sometimes trip ourselves up, is there's the perfect version of spending however many millions of dollars on a system and doing all the things. And then there's, please just do an after action review and write 3 pages of notes. Right? And that sometimes that lighter touch, easier to do one is going to be more transformational anyway. And it doesn't always, not that you don't need to invest, you do. But really the investment is in the people. And the investment is in people having the time to sit down and reflect and then being able to store it somewhere. There's this fabulous podcast that one of our folks, Alfred, he was originally in Sierra Leone and had done a lot of programming, had run the Ebola response in Sierra Leone, and is now in our health programming in Nigeria. 3 weeks into the pandemic, did a podcast of here's everything we learned that you all need to listen, you need to think about based on what I know. And that kind of investment in the staff and their ability to actually apply a lesson learned and not creating all of these organizational barriers that make it that you have to do it even when you know it's the wrong way to get it done, I think is really important. I don't know if that's the most transformational, but that idea of every person on staff should feel empowered to learn and should feel supported to learn. And that's going to be more transformational than any investment in a technology.
Absolutely.
In our case, I can say that, the funding is obviously going mostly to programming, which is now looking at how to make certain areas, be it food security, health, etc., shock-proof for the next crisis. So the investment is being there more than on knowledge management. But that said, programming, has picked up the trends and has, been informed basically from the work that has come from the hub, which is the knowledge management part. You know, so the working groups that we have now, etc., they have all been born out of the trends that we've seen on the COVID hub. So it's kind of, you know, it informs each other, kind of.
Yeah, there's definitely a two-way street or a back and forth there. Stacy, is there anything you would like to add from our end or?
Yeah, sure. Thanks, Adrian. First of all, thank you to all of the panelists. This has been such an amazing conversation. So I want to echo every time Adrian says, we're so grateful for your input. We are so grateful for your input. So thank you for that. Yeah, I find this question about institutionalizing stronger knowledge and learning infrastructure and functions in our organizations and across our organizations to be really critical. Sophie in the chat also referenced this when she said, you know, is there any effort to sort of coordinate all of these learning efforts that are being shared from the panelists and in the chat? And I think that's a world I want to live in, where we are able to do that. It is really telling that that so far we can't, as a sector, do that. I mean, we try to do some of it from the multi-donor learning partnership, but actually coordinating all of these learning efforts that are taking place across the sector is so far beyond what we're able to do now. So I think that just underscores how much more efficient and effective our crisis responses could be if we were able to do that. For now, I think, you know, knowledge sharing forums like this are one way to synthesize and aggregate what we're doing. But yeah, wouldn't that be amazing if we could do it across the whole sector? So yet another reason for greater investments, I think, in knowledge and learning going forward. That's it for now. Thanks.
Thanks, Stacy. I kind of want to try for us to end up on a more positive note or not positive, not that this question has been so dreadful, right? This conversation, no. But end up on a higher note, on some hope. And it's been really clear, right? And Peter mentioned it, Ritu mentioned it, and there were conversations around that. Climate change, for example, it's something that is very present and a reality to all of us. And I wonder if, you know, to still be realistic, but if we could put in some hope as to how we think and how we envision, and how we're preparing our work right now to be able to inform some of that, and how right this minute in 2021, we are putting in place things and doing things that need to be done to also address climate change from a knowledge management perspective. Who would like to start us off? Okay, Gabriela, I'll go with you since you're in the middle.
Okay, that's fine. Well, you know, it's interesting because if we would have a word cloud of the current trends from what our researchers are doing, the word recovery, you know, comes up quite a bit. And it comes up, you know, in everything, what you're saying, like, you know, climate change, food security, etc. And it's all, I mean, it's all tied together, right? And right now, the big project that we're working on is that we've been invited by the Secretary General of the UN to inform our common agenda for the 75th anniversary of the UN, right? So our researchers are feeding into that precisely with this vision of building back better, you know, and how can we make our world shock-proof, resistant for the next crisis, etc. But everything that has to do with recovery, and that includes the green recovery, you know, making, you know, really taking this climate change situation seriously, etc. So that is something that we're working on mostly internally. So that is not necessarily public just yet, but it will be for the next UN General Assembly. So it's part of our work in the knowledge management and communications part, but it's not as, you know, public yet, but it's there, and it's definitely the biggest issue right now. Everything that has to do with recovery and building back better, for sure.
So I'm hearing, and please correct me if I'm rephrasing this incorrectly, but I'm hearing that your current efforts are helping to inform an even larger platform, different learning agendas to lead that recovery effort and recovery in general, right?
Yeah.
Okay, thank you. What about you, Kerry?
Sure. So my positive note, not particularly related to climate change, but I do think what I've seen, I mean, I put one thing in the chat about COVID. So around sort of future areas where we need to synthesize our knowledge and better be prepared is a key focus of their work beyond children. I mean, long-term response to COVID-19 generally. I think other sort of positive things that have come out of it, I guess, which may affect in the future. I think this kind of very obvious and very clear and explicit return to a focus on equity, or the flip side of socioeconomic inequality, and how that's a thread throughout all of our work, and renewed attention to that is very positive. I think, again, a sort of increasing recognition that that evidence generation can't take place outside of programming. So thinking more about implementation science, adaptive programming and learning, and a renewed attention to that is very positive. I think if we follow through, you know, the constant challenge around system strengthening, every sector intervenes in its own domain, but we've kind of really realized that we do need to think at a systemic level, and what that actually means in terms of responding to a highly complex situation such as a global pandemic. So hopefully there'll be some lesson learned there around system strengthening. And then finally, I think also, you know, the focus, a realization, maybe not to be quite so arrogant as development professionals, you know, returning to the fact that we really need to return to community roots. And when we all disappeared, you know, those were the people who are our frontline workers, our data collectors, our responders, our vaccinators, etc. So to kind of put community perspectives, community knowledge back at the fore as well, I think is really, hopefully, again, starting to change.
Thank you for that. Emily.
Yeah, and just to pick up on Kerry's last comment, the best thing anybody has ever said to me in my career was a knowledge management guy from NASA who said, let go of the idea of yourself as an expert. You are a customer service deliverer. You are in customer service. You don't have all the answers. And the minute you think you do, you're going to do it all wrong. And so there's something there about letting go of that arrogance, letting go of the assumption that like we are the experts and there's a single scientific truth that if we can just convince all these other people in the world to know the scientific truth, then it's all going to be fine. It's not how it's going to work. And that as we think more about how do you invest in equality and how do you invest in systems that support people? And that's part of what the pandemic has shown us, is that it sort of lifted the lid on all of these inequalities that we've just not been focusing on, and that we had sort of accepted as a cost of the systems in the way that they were. And that what that did is put everyone in the world at risk. And so inequality is killing people. And so how do we create those spaces, and how do we keep that at the center of how we think about this work? The climate change space, at least in CARE's work, has been doing that for a lot longer than many of the other kinds of sectors. There's a lot more sort of community-driven analysis and community-driven solution generating, and that's been happening for a long time. How do we build on that, and how do we learn from that? And then how do you connect people to the structures that will support them when resilience is stretched too far, right? Resilience will only get you so much, and then there will be times when that's not enough, and you need to figure out other ways to support people.
Thank you. Yeah, Emily and Kerry, you both hit on right on the inequality, right? Including local voices and going back to that community, returning to communities. That should definitely, right? It seems that that's where we're heading as knowledge management practitioners, as development practitioners as well. But you know, even beyond just our niche work in the grand scheme of things in this world, right? Like that seems where the world is heading, and we see it daily on the news and whatnot. And so, I really appreciate the three of you first and foremost for participating in our our interview process and being part of the report, for being here today and sharing your knowledge and expertise and part of your programs and what you're doing with us. But also for indulging me in trying to end up in a more hopeful note. I think it is easy because a lot of the work that we do, right, working with vulnerable communities, really seeing inequalities that might be that are exacerbated by crises such as COVID-19 can be it's not a rainbow, right? It's not a ray of sunshine, but it's also good to know that there are people like you and people that are in this chat that are working every day to try and correct those and build a better world and build back better. So with that, I thank you all. I thank all the participants for coming, and I will hand it off to Stacy for some closing remarks.
Thank you, Adrian. Thanks to our amazing interns. It's been just a fantastic experience working with Lily Tremblay, Milo Magno, and Mahadir Makonnen. Thank you to our wonderful panelists, Kerry Albirght, Gabriela Keseberg Dávalos, and Emily Janoch. And thank you to our fantastic moderator, Adrian Rivera Reyes. What a great discussion. And the positive note that I want to end on is something that many of the panelists and also people in the chat mentioned, which is that what we have been going through with COVID-19 really shows us what an all hands on deck approach can look like. When all of the parts of our organizations and all of the parts of our sectors come together, engage around a crisis, and address it as a multifaceted crisis that requires solutions in every facet of our development work. The kinds of learning that have been generated, the kinds of adaptivity that we've seen on all levels, programmatic and operational and workforce, have been truly inspiring. And I really hope that among all of the lessons that we capture and carry forward, those lessons around bringing together a holistic response and managing the adaptivity that requires, I hope that is what sticks and what gets institutionalized going forward. Okay, so that's all I have. Adrian, I wonder if you just want to say one more time about sharing out
Yes.
the report. Thanks, everybody.
Yes. Thank you, Stacy. So for this webinar, we are recording it and we will share it. We don't yet have a specific website where it will be posted, but we assure that it will be posted. We'll also include it in the report. The report will take a couple more weeks to be fully cleared and then published, and we'll make that available. And we'll make sure to share both the report, the 2-pager, and the recording via email through the same email list. And if you are, and I will share this on the chat, if you want to reach out to us, we have a KMOL at USAID.gov email. So if for some reason you want to get the report and you aren't willing or haven't been able to find it, or we never got it to you, please feel free to reach out and we'll do that. The report is it was a lot of really great work from our 3 interns and a lot of knowledge that our panelists included and many of you shared with us that is compiled there. And it was our goal to make it as useful as possible for all of you and knowledge management practitioners. So thank you again to everyone for coming today, and thank you to our 3 wonderful panelists. And I want to thank Stacy, who is our wonderful leader, and for leading us into this work. So thank you, Stacy, and thank you, everyone.